Hi, Stefan Hartman, Iron Direct Primary Care. I'm here with Diego, Dr. D Sports Chiro. We're at his gym, Steel Gym in Orlando.
Yep. Thank you for coming, man. I appreciate it.
I love being here. I love getting a great bump in. Today we're talking about human performance labs, how to assess the athletes and how to monitor the labs and reduce risk. So one of the first things I want to talk about is blood pressure. So blood pressure is probably one of the most important things that the bodybuilder, the athlete, and the general population can monitor. I recommend that someone get a blood pressure cuff, electronic, usually an upper arm cuff rather than a
Super
wrist.
cheap too. So you can
Cheap.
get it. Amazon, you can get
Publix, Amazon, Walgreens. Don't get a wrist cuff, get an upper arm. Make sure it's big enough. If you're a big guy with a huge bicep, make sure it's big enough for you.
Yes, yes, yes.
You got Arnold arms, get the big one, okay? The one for the obese patient. Even if you're not obese, I mean, you need a big one. Because otherwise, you will get a falsely elevated reading, make you a bit anxious about high blood pressure. But that's like another point is don't get too anxious about one reading, okay? Monitor it.
Yeah, you have to take multiple, and sometimes at different times too, because depending if you might be stressed that day, anxiety, so it all depends. So you definitely want to take it at least maybe in the morning and at night, and keep doing that for about a week and see what's your average.
Yeah, bring it to me, the primary care. We'll take a look at this. It's not a rush, okay? We don't need to rush to the ER for a high blood pressure reading. We can figure this out with a good primary care.
And we need to also find out what is your blood pressure. So some people might be, their normal might be a little bit elevated than what the book says, but that doesn't mean they're off. So that's why you need somebody like Stefan that will help you out with that.
Yeah, and there's medications we can use. There's natural supplements. Heck, it might even be, as in this case here, this patient was taking testosterone and he was not donating blood. So you can see here his hemoglobin went up to 19.4.
Yeah.
And he was having high blood pressure. I said, listen, you're on testosterone. You need to make a habit of donating blood on a regular basis. And so that's what we did for this patient, and we were able to improve his blood pressure.
And how often on a regular basis would that be?
Depends how quickly they generate red blood cells. So we need to be monitoring their CBC. Sometimes we'll do it monthly for a time, maybe every 3 months, to figure out how quickly are they generating red blood cells. And some guys, I have patients who they need actually a prescription from me to donate blood at the Red Blood Bus or the Red Cross, whatever it is.
Because they do that often.
They do it once a month
Wow.
sometimes. Yeah.
Okay, great.
Some people are high producers.
Yeah, perfect, yeah.
Other people every 3 months. I have some guys on testosterone. They don't even need to donate. Their hemoglobin's 15, no high blood pressure. It's really patient dependent.
Yeah, that's perfect. That's good to know, because some people are like, oh, I can't do that, but that's great to know.
Yeah. This is something that I want to make sure all bodybuilders are aware of. It's called the cystatin C. So if you go to your doctor and you get a comprehensive metabolic panel, you'll get a creatinine. Creatinine is an old marker of assessing kidney function. However, if you're a bodybuilder and you have high muscle mass and you're taking creatine and you're eating lots of protein, you will get high creatinine in your blood. Now, a regular doctor might see that, panic, and send you to a nephrologist for a kidney biopsy.
Yep.
What they need to do instead is they need to order something called a cystatin C. This is a new test as of 2021.
And to add on that point that you just said, it's very important to do that. What you said is very important, because some people go to the wrong doctor who they don't know what they're doing. So when they do read those things, they freak them out, like, you're dying. This is not right. Stop what you're doing. That's it. Go to the ER. So you need somebody who's in the world of bodybuilding, or somebody who's in the fitness and wellness, so they look at the readings and say, like, hey, there's nothing to be alarmed. What are you on? What are you taking? Okay, great. Let's change that a little bit. So that's perfect. Yeah.
Yeah, and so this is a good example. This is a young guy. He is taking creatine, eating huge amount of protein. His creatinine was multiple times 1.51, 1.56.
A lot of red meat.
Yeah, they were the regular doctor was kind of worried. He came to me. I like, all right, listen, let's do the proper calculation. You can go on kidneyfoundation.org, and this is a calculator. You input the creatinine value, the cystatin C value, the age, the gender. You do a calculation, and then you look at the CKD EPI creatinine cystatin C equation as of 2021, and he gets a result of 77. And if you look at what the 77 means, it means they do not need to be referred to the nephrologist. Referral to the nephrologist is not needed.
And you can all do it from there.
You can do it from this test. This test costs about $40 add-on test, but you can save yourself a referral to a nephrologist and a kidney biopsy.
Yeah, and also a super scared that you're dying.
Super scared that you're dying and you're going to lose your kidney.
Yeah.
No, we just do the right testing and we save this patient a whole lot of money and panic. So, yeah. And this guy, he was super lean, top 1% physique. I mean, this guy didn't look like he was dying.
Yeah.
You have to also look in perspective.
Yeah, it's not how you look. Like sometimes, like it's. I always tell my patients, it's if you buy a brand new car, right? It's a 2024, and you drive around the country. It looks brand new, but the inside, it's not so new anymore, right?
Make sure you're looking inside.
Yes, so that's what you have to get. It's key to get your lab work done.
Okay. Oh, thyroid. We're gonna get to thyroid here next. So we're talking about the thyroid matters. So these are actually my labs here. So my TSH has been high a couple times. 5.5, 5.35. So typically when you go to a doctor, that's all they measure. They just measure the TSH and they call it a day. However, you need to look at everything else. You need to look at the T4 and the T3.
Yes.
My T4 was actually pretty good, 1.6. I had plenty of T4. My T3, I like it to be a little bit higher. I'd like it to be above 3. But I really didn't have any symptoms of hypothyroidism other than maybe a little bit of a cold intolerance. Maybe I was a little bit low on thyroid.
You kept your eyebrows, everything was good?
Yeah, everything was good. I started taking iodine, selenium, and I've actually been able to improve it from a T3 of 2.4 to 2.9.
Yeah.
So my T3 is improving a little bit, but I want a little bit more, so I'm actually taking a little bit of thyroid hormone right now just to see how I feel. I feel fine, I mean, with or without it. So,
how often are you taking that?
I take it once a day in the morning. I'm using it because...
And it's
oral, yeah. I take it because I was getting a little bit tired in tennis tournaments. My endurance was a little bit low. So I'm looking for that peak performance.
Yes.
My T3, even though I feel a little bit okay, I want that optimization. So I'm going to see and how good I can feel with a little bit more.
And again, you're an athlete, so you want that extra 5%, 10%,
Yes.
right? There's some people who don't require that. The everyday folk, maybe they don't need that to that extent, but somebody like you, that's great.
I do. But then most patients, I will talk to them, clinical symptoms. If they match hypothyroidism, I will treat them. I don't base it off a lab value. Even if they had normal TSH, maybe 3 is normal, right?
Yeah.
But the T3 was maybe a little bit low, maybe 2.7, 2.8, and they have symptoms. They're low energy, their hair is thinning, they're obese. I treat them. I see how they respond to it.
Individual basis.
Yeah.
You look at it because again, those numbers are there.
Yeah.
It's just those numbers are just what the average patient is. It doesn't take in consideration everybody else. So when somebody like them, somebody with experience like yourself looks at the numbers, they're like, hey, let's play around with a little bit of this, a little bit of that, and that would definitely change the patient's world. So yeah, perfect. Yeah.
What else are we going to talk about? Testosterone. So this is a blood value that you can see and expect with someone running high levels of testosterone replacement therapy. I wouldn't even call this replacement. This is bodybuilder dose. So I don't prescribe the bodybuilder dose. This is something that they just get. But what I will do is I will manage their risk. I monitor their blood values. I look at their liver. I look at their blood pressure, their sleep apnea. I do ultrasound of the heart, of the aorta, of the carotid. So I help manage their risk. I make sure that if they're going to do this stuff, they're not going to kill themselves.
Do it right, yeah.
Right.
Yeah, do it correct. Do it. Be smart about it.
Be smart about it.
Educate yourself. Don't just be doing anything just for the heck of it.
My point is to educate the patient, give them the data so that they have the resources to know if they're doing something that might be hurting themselves.
Yes, because most people, they're going to do what they're going to do. They're adults, so let's do it safe. So get somebody again, like Stefan. He knows he has the experience, and he'll tell you exactly what those levels should be.
Yeah, so this is somebody, he's running 600 milligrams a week. His estrogen was about 78. This is somebody who was getting gynecomastia.
Yeah.
So
how old? You remember?
Very young. Very young.
Wow.
Yeah. I mean, he's bodybuilder. He's trying to compete.
Yes.
Yeah. So this is a bit of a problem. He also had very low iodine levels. So serum iodine levels below 35. And he was taking a multivitamin that had 150 micrograms of iodine in there. And it shed on the bottle 600% of the daily recommended value, whatever.
Yeah.
Still deficient. When you're iodine deficient, you will become estrogen dominant. Iodine protects your prostate from the growth. It protects your breasts from getting the cancer. For women, it protects the ovaries. It protects the uterus from estrogen dominant syndrome. And it obviously also protects your thyroid from thyroid cysts, hypothyroidism. So iodine is very important. It's not something that a lot of people are aware of. But I want to make sure everybody is aware of iodine and its protective effects.
Yeah, like myself, I'm not very. I haven't really studied the iodine, so that's great to know. So
yeah. So yeah, iodine deficiency is rampant. It's as rampant as vitamin D deficiency. Everybody has it. Iodine deficiency, vitamin D deficiency, because everyone's not getting sunlight. They're not taking enough vitamin D supplement.
Nowadays, everyone's at home doing your computer work or whatever.
Correct.
So they're not leaving the
Correct.
house.
Let's see. So here's some data points. I did a lot of serum testing at Iron DPC. I tested approximately 50 patients. Everybody was iodine deficient. There wasn't one person that had enough iodine unless they were taking milligrams of iodine, not micrograms. They were taking milligrams of iodine. They need a lot.
Yeah, that's definitely. I mean, all 50.
Yes.
Wow.
And then I tested 50 in their urine. So I do something called the iodine challenge test. It's where they do a morning screen of the urine, and it assesses their iodine. Even by WHO standards, less than 0.1 milligram per deciliter is deficiency. Most people are around that. And then I give them 50 milligram iodine tablets, and then I test their urine over 24 hours. And we see how much iodine they excrete. And
what do you recommend any nutrition-wise, diet-wise, anything that can help them naturally?
Well, naturally, we don't get it in the U.S. So in Japanese culture and Korean culture, they'll consume about 3 to 12 milligrams of iodine per day in seaweed, in kelp, in nori, in kombu.
Yep.
But it's not a part of our culture. I don't think it's part of Hispanic culture either.
No. Unless you go to sushi restaurants.
That's Japanese culture. So we're not getting it in the diet anywhere. And our multivitamin has 150 micrograms. It is nothing because we consume a lot of fluoride, chlorine, bromide. It's in the tap water. It's in the bread products. So we're getting all these halogens that compete for the binding sites of iodine. So everyone's deficient. That little 150 microgram never stood a chance against the tap water.
Okay, gotcha.
So yeah, they did the 24-hour challenge test, and we see how much iodine they excrete in the urine. So for example, I give them 50 milligrams. At the end of 24 hours, they excreted 25 milligrams in the urine. Where did the rest of the 25 go? Their body kept it because the body needs it. So that can determine the dose.
Gotcha.
Here's the pee test. So this is my pee samples, two tubes. You got to keep this thing in your fridge. Let's talk about cardiovascular risk assessment. So this is an example of some inflammatory labs. So these are actually my labs. I had a bit of high C-reactive protein cardiac. I had an elevated CRP. My Lp(a)2 was a little bit high, and my oxidized LDL was super high, 425. I was kind of concerned about this. So I did a lot of preventative measures. I started taking a lot of supplements. I looked at my house. I got rid of some mold that I was dealing with in the house. And then I retested, and my labs improved a lot. My oxidized LDL, it improved. My Lp(a)2, it normalized. My CRP, it normalized. My LDL is still a little bit high. I'm not too worried about that. I do eat meat. I do eat eggs. I'm going to have higher cholesterol.
What is your typical diet so people know?
I'm eating eggs, beef, avocado. I eat a lot of saturated fat and meat. So my LDL is going to run higher. But what I really didn't want was all that inflammation in my body. That will cause a problem for me in the future. So I did a lot of things to improve this. A lot of supplements, even changing my house. I had to get rid of the mold.
Yeah, that's number one.
I think that was causing a lot of that inflammation in my body. So it's not so much as just lowering cholesterol. You got to look at the inflammatory markers. You got to look at the blood pressure. You got to look at what else they're putting in the body. Are they smoking? Are they drinking alcohol? Are they taking high doses of anabolic steroids that are maybe a little bit toxic to the body? All of these things can drive up inflammation.
Gotcha.
So we want to look at inflammation, and we want to look at lipids. If the lipids are crazy high, so my triglycerides were very good. My triglycerides were 40. Super good triglycerides, right? I don't eat a lot of processed carbohydrate, processed
You're
foods.
pretty clean. I mean, you eat
very
everything.
clean.
It's all
no
natural.
donuts and stuff, nothing like that.
Organic, No, I mean, once in a week I will eat something bad. Don't get me wrong, but pretty good.
Other thing very interesting is my insulin levels are super low always. So when you see low insulin levels, this is someone who's not eating a lot of processed foods and the carbohydrates. So myself, I eat relatively low carbohydrate. I mean, when I do eat carbs, it's complex carbohydrate or it's fermented foods like sourdough, it's kimchi, I eat these sort of things. But I'm also a high performance athlete. I burn a lot of energy, and this will lower the triglycerides as well. When you have someone who's sitting around, who's eating a lot of carbohydrates, their insulin is going to go up to 30. Their triglycerides are going to go up to 200. They're drinking alcohol as well. It's not helpful.
And then they're going to kill the insulin receptors too.
Correct. And they're going to get type 2 diabetes.
Eventually.
That's why I like measuring insulin levels, because I can put it on the map for people years before they become a type 2 diabetic. So the idea is that if you have chronically high insulin levels, basically you're redlining your pancreas.
Yes.
It's like driving your car in first gear for many, many years.
Just beating the crap out of it.
Beating the crap out of it.
Yeah, destroying it, just revving the engine and not caring for it. Yep.
So these people will develop type 2 diabetes in the future. That means that they no longer produce insulin. So they need to be given insulin injections. So if I can screen them with a fasting insulin 20 years before that happens, I can say, listen, we can make lifestyle changes. We can save your pancreas.
Yep.
But you need to make the change.
Yep.
So
100%, man.
That's why I ordered
You got to take the first steps and to make those changes. You know, some people think they wait too long, and then after that, they're like, well, why did this happen to me? Why is this? Because you waited 20 years and you're 100 pounds overweight, and now you're 50. But maybe you would change when you're 40, then you can get better results.
Yeah. So next thing I want to talk about is nutrient testing. So we just talked about the iodine challenge test, and so this is the halogen that I was talking about: the fluoride, chlorine, bromine, iodine. Iodine is down here on the table, so it has less affinity towards binding to our tissues than the other ones. So there's serum testing, there's urinary metabolite testing, and there's white blood cell micronutrients testing. The best one is the white blood cell micronutrient because that is a 30-day average of your nutritional status.
Oh.
If you do a serum blood test and you check your B12 level, this is really just a marker of whether you take a B12 supplement in the previous days, right?
Yeah.
A urinary metabolite is how much you're excreting. Really, this is only useful if you're trying to do the iodine challenge test.
Yeah.
Otherwise, it's just, again, how much vitamin you're taking and how much you're urinating out.
Yeah.
It's not a great test.
Yeah.
So let's show you an example of this. So this is a white blood cell micronutrient test for myself. Here it shows us the serum and the white blood cells side by side of selenium. So the reason I'm low in the selenium serum is because I ran out of my selenium supplement in the days prior to this test.
Okay.
My white blood cell micronutrient is perfect.
Yes.
Because over the past month, I had been taking the supplement.
Yeah.
So this is why serum testing I find is useless.
Yeah.
So this is a new perspective for me, is don't get so hyped up about a high level or a low level in a serum test. It tells you whether you took your pill.
Yep. Oh, okay.
Yeah, funny, right? This is interesting. So this is my cysteine and my glutathione. So these are antioxidants. So this is my white blood cell micronutrient and serum. And my white blood cell is still low in my cysteine.
Yeah, that's good.
So I want to improve my antioxidants. So I'm starting to take more of the precursor to glutathione, which is cysteine and glycine. These two produce glutathione. And the glutathione is also very low.
So more amino acids than glycine. Yeah.
I need more, and I think I may need more because I exercise so much. I burn through my glutathione, my antioxidants.
Yep. And again, you're a high performance athlete. The way you tennis, I mean, you're always moving, so you're bringing a lot more calories, more. So you do need those amino acids, right?
I do need the amino acids. I need a lot more. I think all athletes need more amino acids.
And as you age too, I mean, for what you do, you're probably the oldest, or like your age group.
I am the oldest in my age group.
You are the oldest
in professional tennis. Yeah,
good for you.
It's
bro.
kids I'm playing against. They're like 15.
Hey, this is working then, huh?
It is. There's a couple more testing. So these are all just other ways you can test the white blood cell. You can test all your amino acids. You can test your other B vitamins, your omega-3s, very important as well. You want a high omega-3 to 6 ratio. You want low omega-6. You want high omega-3s.
And this test, how do you perform it on the patient?
So it's a blood test. They come to my office. We draw the blood. My nurse draws the blood.
That's it.
And we get it tested. So I like my omega-3 super high. I like to see that. Low omega-6. Omega-6 is the seed oils, right? The people eating the Chick-fil-A, the fried chickens, they're going to have high omega-6. This is not good. You want high omega-3.
Yeah, 6, yeah.
Yeah, I actually also take omega-3s as well. And I eat sardines.
Yeah, so you're pretty set.
I got a lot of omega-3s.
I mean, once you have the fish, you eat good fish. I mean, a little more, not bad, you know. But you should be.
You want that maximized as high as you can. A couple other things we're going to talk about before we finish this year is imaging. So this is the coronary artery calcium score. So this is a CT, low-dose CT scan. It takes like 2 minutes, and it looks at how much calcium plaquing is in your arteries.
Especially if you're taking hormones.
Yeah.
Like tests.
Yeah, you need to monitor this. I mean, some people can have genetic reasons for this, but in my literature review of this, I've actually identified that it's K1 and K2 deficiency. It's a vitamin deficiency.
Wow.
So K1 and K2, they make sure calcium mineralizes the bones rather than your arteries, rather than your aorta, rather than your pineal gland in your brain. So you take K1, K2, and you make sure these are optimized. You look at the white blood cell micronutrient level, and you make sure you have sufficient K1 and K2 intake.
And oral too.
I'd say oral supplement is the best. You can get it if you eat grass-fed beef. The cow that eats the grass, it's gonna eat high greens, and the meat profile will have K1 and K2. You can also get it from green leafy vegetables, but I don't eat so much of that, so because I don't like it. Other things you can monitor is cardiac ultrasound. So the bodybuilder who's taking anabolic steroids, they grow muscle, they don't want to grow their heart muscle.
Yes.
The heart's the one muscle you do not want to grow. Okay. See,
what if they got a big heart and they love?
And they're gonna die.
Oh.
Rich Piana.
Okay.
Rich Piana.
Oh, he's over there.
He's over there. Rest in peace.
Yeah.
Died of cardiomegaly
Yep.
because he did a lot of hormones and he lifted a lot of weight. His heart got too big. He died early age. If he had come to us, we would have done an ultrasound. We would have put him on telmisartan. This is angiotensin receptor blocker. We put him on a beta blocker like Nibivalov.
Yep.
We may have been able to prevent the heart from growing. But once the heart is grown, it's difficult to make it grow back.
Yeah. I think, yeah.
The other thing that makes the heart grow is sleep apnea. If you're such a big bodybuilder, you have so much mass, you're going to suffocate yourself at night. And this will make heart grow. So you got to.
So this is very important. Let's stay in this topic then. K1, K2.
Yeah.
Okay.
K1, K2. Get ultrasound done. Abdominal ultrasound. It can look at calcification of your aorta or your aorta. You don't want your aorta to harden and calcify. You die this way. Yeah. Okay. It also will grow if you have high blood pressure. If you have a big aorta, it will rupture, burst. You're gonna die very quickly. It's a good way to die. So you need to monitor this. Another thing we like to monitor is the carotid arteries. You can see if they're getting a plaque. If the carotid artery gets a plaque, you're gonna get a stroke. You're gonna die. Okay, so you need to monitor this. You need to monitor your blood pressure. You don't smoke. You make sure it's not getting narrow.
Yes.
We talked about all this sleep apnea study. We can do a home sleep study. You don't need to go to the pulmonologist. I order this test.
Because those studies to do are horrible. You got to stay overnight. They cook you all up. I mean, nobody wants to do them.
No. Yep. I can order it. It gets shipped to the patient's home. Wow. They monitor home. It gets read by a board-certified pulmonologist, and we get a result. We find out if they sleep apnea.
Oh, wow. That's good to know. I didn't know that.
If they're bodybuilder with sleep apnea, they're super big. Maybe they're obese. They need it so that they can breathe at night. And it'll protect their heart from growing. Yeah. Let's see. I think that's all we had for this. I hope that was helpful.
Thank you so much for coming, man. I think I learned a lot myself. And then if you have any more questions, please reach out to Stefan at Iron DPC. And man, come whenever you want. This is your home.
It's fun. I love this gym.
Thanks, man.
You got a great
Appreciate it, man. Yeah, man. You look great.